All right, so I also want to go over some dissections that I didn't go over in the last video. So there's only two of them here that I want to actually go over. So we'll go over those shortly. So the first dissection is the ankle and foot, the superficial dissection. So this one right here. So all right, right. So we're seeing our ankle, right? So we can see our calcaneal tendon, our Achilles tendon, right? And then if we move over here, we see the tibia, right? And then remember at the ankle, I said that it's Tom, Dick, and Harry, right? So Tom is tibialis posterior, Dick is flexor digitorum longus, and Harry is flexor hallucis longus or hallucis longus, right? So Tom, Dick, Harry. And then we also have our posterior tibial artery, and usually it's running with the vein as well, but we can't see it here. So posterior tibial artery, and and then we also see the tibial nerve, right? And one other thing is plantaris, right? Plantaris is also attaching to the calcaneal tendon. And I'm pretty sure I didn't show calcaneus in the last video. I think I didn't, so let me just go over that briefly. That was the muscle I forgot. My apologies. All right, so if we move the calcaneus, right, all the way here. So plantaris is going all the way from the femur, right? So you can see it going all the way from the femur, right? So this is our femur, all the way to the calcaneus, right? All the way to the calcaneal tendon, right? And this is going to be responsible for flexing the knee and plantar flexing the ankle, right? So this is plantaris, right? And we get plantaris and soleus confused a lot. So plantaris, I mean, we get plantaris and popliteus confused a lot. So plantaris is here, popliteus is deep to that. And popliteus attaches to the lateral condyle of the femur all the way to the tibia and is responsible for unlocking the knee joint during flexion, right? So unlocking the knee joint during flexion. All right, so the popliteus muscle needs to contract and it causes flexion and lateral rotation of the femur on the tibia. All right, so it's basically the key to the lock knee. So your knee locks in full extension, and for flexion to happen, your it needs to unlock. So basically, the femur is laterally rotating on the tibia, right, to unlock the knee joint. And this muscle is doing that action, popliteus. Right? Don't get plantaris confused with popliteus because plantaris is responsible for flexing the knee and flexing plantar flexing the ankle. So flex knee, plantar flex ankle. Okay, now that we have that, let's go back to the dissection. All right, so we were seeing, so this is plantaris. You can see it attaching to the calcaneal tendon. Right, flexor hallucis longus, flexor digitorum longus, and tibialis posterior. We also saw the tibial nerve and posterior tibial artery, which should be running with posterior tibial vein, but it can't be seen on this dissection, right? And we also have, right? That's it. That's about it, right? We also have the bone, the calcaneal bone, but we can't really see that here. So let me move on to the next dissection. All right, so we have the calcaneus bone here, but we can't really see that. Now let's move on to the next dissection here. Right, so this is the ankle and foot deep vessel dissection. Right, so the first thing that I want to start off is, right, so this is our tibialis anterior, right, and then our tibia would be deep to that or more medial, right, so this is our tibialis anterior, right, and then lateral to that we can see our deep fibular nerve. If you see peroneal, fibular, right, those are the same words. They're synonyms for the same structure. So peroneal, fibular, right? Those are synonyms, right? So we have our tibialis anterior, we have our deep fibular nerve, and then we have our anterior tibial artery, anterior tibial vein, right? So the happy day. So in between tibialis anterior and extensor hallucis longus, we can see the deep fibular nerve, we can see the anterior tibial artery and vein. Right, so the for tibialis anterior, happy for extensor hallucis longus, and day for extensor digitorum longus. So the happy day. Right, and you can also see the tendon for fibularis longus, and you can also see the tendon and the muscle body for fibularis brevis, right, in the lateral compartment, right? So these are responsible for foot eversion, right? And that's about it, right? That's about all that we need to know. Yeah, that's about all we need to know. So I think that's all the dissections that would actually help you guys see things from a different perspective. I hope this helps, guys. Good luck.